Okay, so I just wanted to make a first trimester pregnancy video and kind of explain how my first trimester was, things that we kind of went through, basically how I knew I was pregnant or why I thought I could be pregnant, just anything like that, symptoms, all that kind of stuff. So Kevin and I weren't really trying. We weren't trying not to get pregnant, but we weren't really making an effort to get pregnant and have a baby. But everything happens as it may, and it just happened to be our time. So a couple things that made me think that I could be pregnant was I knew something was off. Basically, just a TMI, there will be period talk mentioned, blood, all of this kind of stuff. So if you're not cool with that, just turn this video off right now. It's just part of pregnancy and women life, and it's just lots of fun. So just a FYI that there will be some of that conversation here. Anyways, so I knew that something was off, and basically it was the week leading up to, not even the week leading up to when I was getting my period, it was the week that I was supposed to get my period, that I was just waking up at night with these horrible cramps. And it just kind of felt like pre-period cramps, although I've never really had those. I basically, when I get my period, that's when I get cramps. And they're normally not this bad. This was so bad that I'd be up for a half an hour, 45 minutes in the middle of the night, not being able to sleep just because the cramps would wake me up, or not being able to get back to sleep, or walking and I'd be like, oh my God, my stomach hurts. So that was one of the things that both him and I were kind of like, well, something's off. We weren't really sure what yet, but we knew that something was really weird and off. I basically felt extremely bloated, regardless of what I was doing. And I was trying pretty hard to lose weight and be in the gym, and I was eating properly so that I essentially could lose some weight. I was working out extremely hard. I was doing HIIT training. I was doing weight training all on the same day. I was working out 6 to 7 days a week, hours on end, and I just wasn't seeing any progress. And it just seemed a little off to me. All of my bras were getting quite a little bit uncomfortable. It was just really tight, especially in and around here, which also, again, wasn't very fun. And the big one was, by the time I hit Friday, when I finally took a test, was I was officially 5 days late for my period. So that, on top of the fact that I'd been waking up with cramps, that I just was feeling a little off, I was just like, you know what, I might be pregnant, I'll go take a test. And so essentially what I did was I went to the dollar store, just because the tests are a lot cheaper, and they'll give you the same prediction. I went there and I bought 3 tests because I had already been up, already gotten ready for the gym, was at the gym when my friend suggested to take a test. And so I went, you know what, the dollar store's right there. I'll just run, grab 3. I'll take one now just to kind of ease my mind and my anxiety, and it should come back negative. And then if it does, I can always take tests later on through the week. So my plan was to take one the very next morning with essentially your first pee of the day, because that is the most potent if you are pregnant. And then I had another one to take basically a week later, just in case it still hadn't come. So I had gotten home, took the test, and essentially what happens is you have the control line here, and then here is where it will tell you if you're pregnant or not, and that washes over in usually pink. Pink was mine. And so it completely washed over in pink, and then you watch it slowly fade away. And as it faded, there was one line there, and I went, cool, that might be the control line, although there was a T above it, which stands for test. And then the control line was quite obvious as well, and I was just like, well, I guess I'm pregnant. And freaked out and called my friend, and she suggested that I drink as much water as I could and go and take another test, which I did. And that one came back very positive as well. And then I take the third test, and that one also came back positive. So by that point in time, I had taken 3 tests in about an hour and a half or so, and all 3 were positive. And so I was like, well, I know sometimes you get false positives. It's usually not everyone, but it was like, you know what? I have taken pregnancy tests before, and all of them have come back negative. And this is the first time it has been like very clear on a positive test. And I will insert what the one looked like. And it just scared the crap out of me, to be totally honest. Mostly because I also didn't have my partner with me. He was working at the time, and I just didn't feel like bothering him at work, or asking him to come home, or this isn't really a conversation that I wanted to have over the phone. So I just waited until I got home later that night, because unfortunately I then had to leave and go to work without being able to see him. So that was pleasant. My dog just wants to play. So one of the big things for me was that with pregnancy comes a lot of lifestyle changes. So because I was working out a lot, and because I've been lifting and working out for quite some time, I had been used to a specific supplement regime. So in my supplements, let's see if I can reach this dog toy. Really, dog? So in my supplement regime, I basically woke up, took a really strong pre-workout. I would usually work out on an empty stomach. If I had anything, I would maybe have like a small bowl of oatmeal or something. Oh my God, this dog is incessant. And so I basically took my pre-workout. I would get BCAAs ready, which is another drink, and drink that throughout the gym. Sometimes I would take extra beta-alanine or caffeine. Like, my caffeine tolerance is extremely high, but while I was working out, I was taking probably up to 400, 500 milligrams of caffeine every day. So all of that, I came home. When I saw the pregnancy test, I was like, oh, do not consume. Oh, do not consume. This looks like so much fun. So my workouts have basically gone from fueled by pre-workout to fueled by water and self-motivation, which really sucks because there's this dog really wants to play today. So when you're trying to work out and you're pregnant, your workouts change a lot. So that was something that was hard for me, and it is still really hard for me because I would go to the gym and work out for about 2 hours every day, if not more. Sometimes my workouts would consist of things that you really shouldn't do while you're pregnant. And so my workouts have been so limited lately that it's boring. It's not a fun place for me to be anymore, and it's not a place that I'm essentially motivated to be, apart from the fact that I know that working out is good for the baby, it's good for me, it's good for my body, it's good for recovery, it's good for a whole bunch of things. And that's the main reason why I'm still working out as much as I am, which is still every other day to every day, depending on how I feel. I have been really tired, like really, really tired a lot. So that's basically been the main push to not work out some days. But that's basically it. So workouts have changed a lot for me. I also had to go through the cupboard and look at all of the supplements that said, do not take while you're pregnant or breastfeeding. And a lot of the supplements that I was taking were things like herbals, and herbals are things that you really should try to kind of watch out while you're pregnant, more or less, because there's not enough research done to show that some herbals are safe to take and some are not. And some are not. So, my my supplementation went down a lot. Even things that said consult a practitioner if you're pregnant, I just stopped taking them just because I just wasn't sure if I could take them. So it made a big difference in my day-to-day life. Food, thankfully I didn't really have to cut out much or anything. I'm plant-based, whole food vegan anyways. So a lot of the things that you read that you shouldn't consume would be things like unpasteurized cheeses, or some processed meats, or fish, or just different animal products that I don't consume anyway. So that was pretty nice that I never really had to worry about that. The only thing that I really am not supposed to consume is a kombucha, because kombucha is an unpasteurized tea, essentially. It has a lot of really good gut bacteria and good fermentation health to it, but it's just one of those things that you're not really supposed to consume. It's not that it's bad for you, it's one thing that you're gonna have to watch. So the other thing that was a bit of a struggle for me was basically finding teas that I could drink, because there are obviously herbs in tea, and a lot of them do different things. So anything like a thyme tea can be a uterine stimulant, so that could stimulate stimulate, yeah, that's the one. Baby brain is a real thing. It could stimulate any contractions or anything like that, which is pretty not great in the first and second trimester. So it's something that you do kind of want to try to avoid. One of the other ones that I find is in almost every tea, which is extremely annoying, is hibiscus. And hibiscus will actually cut off some of the blood supply to the uterus, which obviously you do not want to do while you're pregnant. So things like that I had to watch out for. Not a big thing. The other one was some of my protein powders. So some of them you have to watch, because some of them will have herbs in them that just, again, haven't been tested enough to say that they're safe. Another one that I really, really like is the Pure Vital Labs protein. And one nice thing about it when you're not pregnant is that it has enzymes in it. So the enzymes will actually help to break down the protein, utilize the amino acids in it, break down food basically throughout your day, or food that you might be consuming with your protein shake or smoothie. However, again, there's not enough research done on enzymes to say that enzymes are safe to consume as well. So I stopped taking that one. So right now, I just kind of switched to anything that says it's just a plant-based protein. So I've been having Vega. Beyond Yourself came out with a really cool vegan protein, so we've been trying that. The Kaizen protein, just a whole bunch of different ones, but I just kind of watch what's in them just to make sure that it's something that I can definitely consume. So some of the worries and concerns that happened in my first trimester was I was spotting quite a bit. Like, it wasn't anything that was intense or a lot of blood or anything really red, but there were just a couple things that if we were intimate the night before, I was almost guaranteed to spot the next day. If I had pushed myself or was stressing too much, I would spot that day. I pretty much spotted almost every day in my first trimester, and most of it was caused by something. So I almost always had at least a reason as to why I was spotting. However, it still didn't make it comfortable in my mind. So that was one thing that I kept thinking, okay, maybe I'm having a miscarriage, or it wasn't comforting when you go to the bathroom, you wipe and there is pink or blood or anything like that. So that wasn't particularly fun. It was just constant miscarriage concerns because of that. So I was under a lot of stress in the first trimester. It's something that's very normal. It does happen to about 35 to 40% of women that they do spot in their first trimester. I believe one of the reasons I was spotting so much is because I had a tilted uterus. So my uterus was actually tilted back towards my spine, which is totally normal. It's called a retroverted uterus. And most of the time, it usually does pop back up into your abdomen when you're hitting about 10 to 12 weeks. because that's when the baby in the uterus is big enough that it just doesn't stay in that position. So it'll always pop back up. And quite interestingly enough, when it did pop up, I spotted for a couple of days again. And that was when I was pretty sure that happened, because I had spotted at that point for no reason. I wasn't stressed. I wasn't overdoing it at work. I wasn't overdoing it at the gym. We had not been intimate the night before or for a little while. So I was a little hesitant to have sex in the first trimester, just because it just always caused spotting. So it was very uncomfortable for me. So after the first trimester though, so after basically when I hit 13 and a half, about 13 and a half, 14 weeks is when I just haven't spotted since. So that's awesome and very alleviating when it comes to stress, because pregnancy in of itself is a very stressful time. So that was something that I wasn't a huge fan of, but it is what it is. Everything's fine. In my first trimester, I actually ended up having 4 ultrasounds. So my first one was at 5 weeks. It was about 5.5, almost 6 weeks. The very first time I had spotted, because it was more blood than I was expecting, or I guess it was a little bit more red than pink. And I was just a little concerned, and that was the very first time. So I just called the doctor's office. They told me to go in if I could. So my coworker basically said that she would cover my shift and that I could leave, go to the doctor's office, get everything taken care of, even if it was just for ease of stress in my mind. It was something that everybody kind of wanted to just make sure everything's okay, and then we'll move forward. So they did an ultrasound at 5.5 weeks. And I have to say that was probably one of the worst ultrasound experiences of my life. My doctor's office sent me, and what ended up happening was, I guess they didn't get the requisition, or the girl that did get the requisition went on lunch just before we actually got there. And then so the girl that was covering, she was the ultrasound tech, but she just wasn't willing to go and ask or look or do anything like that. So eventually we actually just asked her to please go and ask the girl on lunch if she was still in the office about it, because I mean, we had been sent there specifically at that time for that reason, and we just wanted to get it done and over with. The other thing was, at 5.5 weeks, she tried to do an abdominal ultrasound, and it's a little early to see anything at 5.5 weeks with an abdominal. Most of the time, anywhere between 5.5 to 8-9 weeks, they usually do a transvaginal. So they just have this probe, they stick right up there, and it just shows them the uterus, it shows them the baby. But while she was doing the ultrasound, she wouldn't allow my partner in the room. She didn't allow him in the room afterwards. She didn't tell us anything. She just said, okay, your ultrasound's done. You can go home. So there was no comfort. We basically waited around because we knew the doctor's office was waiting for the ultrasound results. So we were pretty sure we would get a call later that day if something had happened, and if nothing had happened, we were just expecting no call, because that's just how the doctors work. Thankfully we didn't get a call, and I had a doctor's appointment, I think the next Wednesday, and this was a Friday that this happened. So the next Wednesday I went in, I talked to the doctor. She said, everything's looking good. Everything is basically on date as it should be, but we'll send you for another ultrasound at 8 weeks. And just to confirm the dating, and then hopefully we'll be able to see a heartbeat or hear a heartbeat at that point, because they weren't able to detect the heartbeat at 5.5 weeks, which is very normal, as the heart usually doesn't form and start beating until about 6.5 weeks sometimes. So then we went for our 8-week ultrasound. That one was a little better. She did everything with me at first. The most uncomfortable thing is you have to drink a lot of water before you go in, and my body filters water very fast. So I drank about 1.5 liters, half an hour before I went in, because I knew how fast my body would go through it. And what was uncomfortable is one, they're pressing right on your bladder and your uterus. So it hurts because it's already full. And she told me my bladder was too full. So I had to go to the bathroom and let some of it out, because that's easy to do. So it just wasn't a very pleasant experience for us. She did allow my partner to come into the room at the end of the ultrasound, which has been typical for us right now. So when he came in, she just showed us what looked like a blob on the screen. And she said the flicker is its heartbeat. She didn't let us hear the heartbeat, and that was basically it. So after that, the other ultrasound, I've had a lot for how far along I am. So it just wasn't high risk. It was just a couple different things. But so my doctor tried to hear the heartbeat with the Doppler at 9 weeks. And because of the tilted uterus, it makes it really difficult to hear the heartbeat. Also, I've read because of an interior placenta, which I'm pretty sure I have, the ultrasound tech wouldn't confirm that at the 20-week. So that also makes it more difficult to hear the heartbeat earlier on. So anyways, she had tried to find the heartbeat, couldn't find the heartbeat at 9 weeks. So she could kind of see the concern in my eyes and my face and was like, you know what? This place, Karma, will take you. And this is the place that we would go for the first trimester screening, which happens at about 12 and a half weeks. So we went there, and the ultrasound tech was amazing. All they do is prenatal ultrasounds. So literally all they deal with every day is pregnant women. So they're very, very nice. They kind of ease your mind when you go in there. They will talk to you the entire time rather than just allowing some awkward silence. This ultrasound technician was apologizing because she had to press so hard on my abdomen to try to find the uterus because it is so tilted. We saw the heartbeat again, and she said, everything looks good, you can go home. So we left, everything was fine. Went back for the 12 and a half week ultrasound, and again, everything looked good. Went back to the same place. The ultrasound tech was talking to me the entire time. Thankfully, baby was relatively cooperative, and it's been good experiences since, and thankfully that's where we've been going, and pretty sure that's where we will get to go the rest of the time if we get very many ultrasounds from here on out, as my OB office is going to be in the same building. I just wrote some notes down so I wouldn't forget too many things. So a couple of my pregnancy symptoms, there haven't been too much. Some of them have been basically extreme fatigue. That's been very interesting for me. I've never felt this tired in my entire life. Basically, I'll wake up and I'm ready to go back to bed. I would pass out at like 6 o'clock in the evening. It's just really, really tiring. I would be doing minimal amount of work, even at work. And honestly, I felt like I got hit by a train, or like a Mack truck. Basically, I would just receive boxes like I normally would. And after 3 boxes, I'd had to sit down because I was just so exhausted. Thankfully, I never really had much nausea. It was very, very minimal. By the time my 12 and a half week appointment came, I had only thrown up twice, and both times was because I ate and then drank way too much water afterwards, which is not fun. If you're pregnant, I'm sure you'll understand what I'm talking about, because essentially your food is sitting so much higher because of obviously making space for the baby. And then the water just sits on top of that, and your stomach and your digestive tract just can't handle it. So it just gets rid of all the water. So thankfully, anytime I've thrown up, I've just thrown up water. So that was not so bad. The worst was at the first trimester screening, because they tell you to drink so much water so you can see the baby. But so essentially I drank all the water and then threw it all up. But thankfully, when I threw it up, I had to pee as I was throwing up. So I knew at that point that I basically was fine and everything was good. The other one is extreme thirst. I was so thirsty in my first like 10, 12 weeks that I would probably drink 4.5 to 5 liters of water every day. It was insane. I have this water bottle. I'm really thirsty even now. I had this water bottle that is 1.5 liters, and I would probably drink about 3 to 5 of those every day. And it was a lot of water. So I was going to the bathroom a lot. But it was just, I would take a sip or drink probably 1/3 of it, and the next thing I knew, like I was just constantly thirsty. So I constantly had to have a water bottle on me. But that was basically it. Sore boobs. Just some typical stuff, but besides that, from the reading and the research that we were doing, because I was physically fit before I got pregnant, a lot of my symptoms have been dramatically reduced. So I never really got the nausea. When I did get, I was able to kind of muster through. It wasn't too bad. One of the problems that I did have was, I can't remember whether it was at the 8-week, was that the 8-week ultrasound or the 8-week doctor's appointment, or the 6 week, but they do, it's almost like a glorified physical, and they'll do swabs, kind of like a pap smear, but not quite. So she did a swab, came back that I had a bacterial infection, and it's called bacterial vaginosis. So that was a lot of fun. You go to the pharmacist and get a cream or gel that you insert into a tube, and then you use that as a suppository. So you insert that into your vagina and put that in there at night, and you can't have sex for the amount of time that you're doing it. It just feels uncomfortable. It is a form of antibiotic, so it will kill all the bacteria in there. But basically what I took from that was I started taking a probiotic every day, just to make sure that, 1, it doesn't come back, 2, my gut health is at optimal levels. Also, I don't really want to be on an antibiotic while I'm in the hospital giving birth. So one of the reasons why I've made sure to take a probiotic is to help prevent group B strep, which they will try to administer antibiotics. It is a very controversial topic on whether to get the antibiotics or not, but I would rather not. So just to kind of prevent anything from happening, I've been taking a probiotic the entire time just to make sure everything's fine. Basically, that was one of the main problems. The spotting was a problem. And that was it, just throwing up if I drank too much water after eating. And then that's been basically it. It hasn't been too hard. First trimester kind of flew by. I am now at, well, tomorrow I'll be 22 weeks. I honestly thought in the first trimester that I had a good baby bump going. It's just, you get really bloated in the first trimester. Now you get bloated all throughout because uterus is pushing up your intestines, pushing up your stomach, and everything just kind of sits in there for a lot longer. Also because of the hormones going on. One of the things that does happen because of hormones is you also do get fairly congested. So that's also been quite fun. I'm sure you can hear it now, is that I'm constantly congested. I have a slight cough all the time because of the postnasal drip. I wake up, I either sneeze a lot or I have to blow my nose immediately because I can't breathe out of my nose, and then I'm fine for a bit. I'm usually fine throughout the day, but in our nursery, we have to clean it up. That's where I'm filming this. It is a little dusty where I am right now, and I do have a slight allergic reaction to dust, but it's not that bad. But that's been basically it. I don't really have much else to kind of put forth in the first trimester. I will do a second trimester video. Second trimester has been a lot easier, and I'm really worried. I'm not really worried, but I'm a little worried about the third trimester because I know that's probably the hardest. I've already been struggling a little bit with just some different things like getting comfortable or moving into certain positions. Like cramps, that's been fun too. So I'll go over kind of like my supplement regime and everything like that and what I take every day just to make sure to kind of keep my levels optimum, especially as someone who is vegan right now. And that's basically it. Our theme for the nursery is going to be farm animals. So because we volunteer so much at a farm sanctuary, we are going to print out some of the pictures of the farm animals there and put them all along the walls. We're gonna still paint, but I'll do another video on what color we're gonna do and why we're doing it, because we now know the gender of the baby, but I'll post that later. It's already on my social media, my Instagram and Facebook. So we did a gender reveal for Christmas, which was really exciting.